Dusty wanted to say hi. Yeah, hi. Okay, hi everybody. We are going to talk today about eye melanoma. I've talked about melanoma in general of the skin, and I've talked about nail melanoma. And today we're going to talk about ocular melanoma, what that is, how it's treated, but how it's diagnosed, what are the signs and symptoms. And I'll talk a lot about what can we do. I always try to include what can we do about these things so that we have a better understanding and possibly save our lives, because we all know that early treatment has more favorable outcomes. So that's why it's so critically important to get frequent and consistent eye exams, even if you feel like your eyes are fine. Ocular melanoma progresses just like any other cancer progresses, where the abnormal cells begin to multiply out of control and create a tumor. With a tumor in the eye, often it's either in the front of the eye or the back of the eye. And often with ocular melanoma, there are no symptoms. So that's again why it's important to get to the eye doctor and have the eyes looked at professionally and have your eyes dilated so that the eye doctor can see the back of your eye to see if there's anything abnormal going on there. Other reasons that the eye doctor might dilate your eyes, besides looking for or ruling out some type of eye melanoma, would be for changes in the blood vessels, macular degeneration, diabetes, and other things. Eye cancers that affect the inside of the eye are intraocular, again, ocular meaning eye, and outside the eye, like the eyelid, underneath the lid, in other areas of your eye on the outside is considered extraocular. So we have intraocular, extraocular. For those of you who are new, my name is Lisa. I'm a registered nurse. Most of my career, but not all, has been in pediatrics. It also has been in adult med-surg, and I was a case manager not just for peds but for soldiers at Madigan Army Medical Center a long time ago during the Iraq and Afghanistan wars. My videos are health related, although I do some fun vlogs and sometimes some recipes, and I hope that if you're interested in that kind of thing, you consider subscribing. Did you all hear about Helen Mirren, the actress? She was married, and her stepson named Rio passed away from eye melanoma when he was age 51. Helen stated in an interview that he did not get eye exams and that he didn't feel he needed to get them because his eyes were fine and he had no symptoms that bothered him or troubled him. And I would say this is probably on the same note as going to the dentist on a regular basis or as often as you're able, just like getting a physical with your physician, because we don't always know what's going on until a full exam is completed, maybe with labs and other things that the physician might be looking at during an exam. Same with the eye exam. It's tragic, it's very sad, and you know, a lot of people are like that, right? They say, I feel fine, so I don't need to ever go for preventative maintenance, because why bother? I feel great. And I completely understand that many people also don't have the means here in the United States. Not everybody has medical insurance. A lot of people, even if they're on state insurance, still have to pay a portion. Some don't, like for children, but most do. And even that can be really expensive. So I completely understand. So if you're able, or if you are near a medical center, or you're able to get to a large teaching hospital or medical center where they have residents, oftentimes the dental school or the residency and clinics will see people for free or reduced exam fee. Bob Marley died from nail melanoma, and his was on his toe. And the other person that I recently read about was Oliver Sacks. So Oliver Sacks had also had ocular melanoma that metastasized to his liver, and that is how he passed away. He is a very famous neurologist from New York. He is an author, he's a speaker, or was, and I've read many of his books. He's one of my favorite authors. And but he did live quite a long, healthy, vibrant life into his 80s, and then he developed ocular melanoma. All right, so ocular melanoma starts in the eye, and it then if not treated, can progress and metastasize throughout the body, usually starting in the liver. There are also cases of ocular cancer in the eye that is secondary. So it's starting, say, as breast cancer or lung cancer and has metastasized to the eye. That is a little bit different. So it can start in the eye, or it can secondarily go to the eye, and you would have cancer then in the eye from another source. You know, I always hesitate when I read things about who's at risk, because so often you say who's at risk: blue-eyed, fair-skinned people who are over the age of 50, family history of melanoma. But so many people don't have any of those risk factors, and yet they still go on to develop ocular melanoma. Now, keep in mind that this is rare. So is nail melanoma. But when you start hearing about it, then, and you hear people, friends or a friend of a friend or a family member who has had this, or somebody famous like Oliver Sacks or Helen Mirren's son, then you are hearing it more and you're realizing this isn't so rare that we never hear about it. It's rare in context of other types of cancers. By the way, can children get ocular melanoma? Yes, but there's that word, extremely rare. Children have a different type of eye cancer. The eye cancer that children have is retinoblastoma, and we used to see quite a bit of that. I mean, of course, when you're working inpatient peds for 20 years, these things become repetitive. You're going to see lots of children with aplastic anemia, leukemia, brain tumors, and retinoblastoma. All right, so what are the main signs and symptoms? So, a symptom is something that the patient or person feels like they are seeing a lot more floaters, or the symptom is something that they are experiencing. A sign, though, is something that they can't necessarily feel. Okay, so let me just go over some of those. Blurred vision, lots of floaters, a change in the shape of the pupil, eye pain. And when you get to the eye exam, the eye doctor might dilate your eyes at that point then and look in the back and see some abnormalities. But some people do see a spot. I'm looking at myself here. It's in a different place, but I'm going to put up pictures like I always do, but they'll see a dark spot. Is that a freckle? Is that something they were born with? It sure might be. Is there some kind of mole going on? But again, it's best to get it checked out just to make sure. Look at some of these pictures. And everybody has floaters, right? You know, you go outside, you look at the sky, you got floaters everywhere, at least I do. But if it changed and became a whole lot worse, or I just noticed some subtle changes even, better to have it checked out just to be sure. I'm going to list below a lot of resources on this topic, and I'm also going to list below the American Ophthalmology Association's guidelines from newborns to older adults on what is recommended for eye exams, and that includes eye dilation. I don't like to get my eyes dilated. It gives me a headache. I always have to go to work. There's just something going on. Like, it takes hours and hours for my eyes to respond and not be dilated anymore. But when I first learned that eye melanoma exists and that the best thing to do is have your eyes dilated every 1 to 2 years, I went right out and I just get it done because I'm one of those people that's going to worry about that. Okay, so I also learned, though, when I did work as a scribe, among other things, for this eye doctor, that there's a reversal drop that exists. I never knew that. Nobody's ever given me a reversal drop. So we would, at least at that retina specialty clinic, we would dilate their eyes and then we'd give them the reversal drop so they could be on their way. Obviously, not everybody likes that or believes in that at certain clinics, because I've asked about that, and my eye doctor, both of them that I've gone to up in Seattle and in the Olympia area, do not use those reversal drops. Have you guys heard about that? Do you use that? Do you get a reversal drop so that you don't have to experience hours of light trying to drive and light coming in and getting a headache? I'm just curious about that. Okay, as far as staging goes, staging for cancer usually, not always, is a stage 1, 2, 3, 4, right? So eye melanoma has staging 1 through 4 as well. And the way that they put this criteria together is that if it's a small tumor confined to the eye, no spreading, it is stage 1. If it's an eye tumor that has become larger or is a specific type of diameter and above, but it's still in the eye, it is stage 2. Stage 3 is when the tumor grows outside the eye into the surrounding tissue, and stage 4 is when it has metastasized to the liver and or other areas of the body. Prognosis depends on the tumor size, the location, the types of cells, and the response to treatment. Everybody's prognosis, just like with all cancers, is very individualized. So it's hard to really say. You could look it up if you wanted to Google it, but there are many nuances to prognosis and survival. What about some treatment options? There can be radiation and laser, and immunotherapy is in the works. Just like immunotherapy and targeted therapies are in the works for many other cancers, it's also something they're working on and using in some places for people with eye melanoma. Now, if things got really bad and the person maybe has lost their vision, or the tumor is so progressed that the eye has to come out, that is also a treatment that is available for that particular person or that group who needs that. People can lose their eye for various other reasons, like massive trauma. There's a lady I'm following. I'll put her information below if you're interested. Her name is Melanie. She just is finishing more treatments at MD Anderson in Texas because she, when she was pregnant with her little girl, who's now age 2, she developed sinus cancer. And it had metastasized. She had to have surgery and her eye was removed. Then time went on and she was without evidence of disease. However, that didn't last long, and during one of her regular PET scans, MRI checkups, they found it in her brain again and in one of her lymph nodes. So she went to MD Anderson for more treatment. She is somebody that you will feel blessed that you ever got to know her, whether you follow her on Instagram or on YouTube. Her life and her story and her outlook on life during this will have a positive impact on your life. Okay, so remember that early treatment is critical. Continuing on with eye exams on a regular basis is really important, because early detection is what we want. We want to catch things in an early stage and begin treatment as soon as possible. Please don't let the thought of money, try your best to let the thought of money or inability to get to the destination of the medical center, or the fact that you don't have any medical insurance, get in the way, because your life is much more important. There are people to speak with, like case managers, social workers, finance departments, and going to teaching hospitals that can help you with this. Ocular melanoma may be rare, but knowledge is power. Take care of your eyes, protect your health, and I'll see you in the next video. If this was helpful for you, please pass it along. Please do this, because a thumbs up is what helps the algorithm so other people can enjoy the video, can benefit from the video, and that, as I always say, our videos sit down in the dungeon or somewhere else that nobody ever sees unless people interact, subscribe, and like a video. Thanks for watching, and I'll see you in the next video.